Diabetes mellitus, commonly referred to as diabetes, is a chronic medical condition characterized by elevated levels of glucose sugar in the blood. It occurs when the body's ability to regulate blood sugar is impaired, leading to various health complications. There are several types of diabetes, but the two most common ones are type 1 diabetes and type 2 diabetes. Here's an in-depth look at diabetes mellitus. Type 1 diabetes. Cause. Type 1 diabetes is an autoimmune disease in which the body's immune system mistakenly attacks and destroys the insulin-producing beta cells in the pancreas. This results in little to no insulin production. Onset. It often develops in childhood or adolescence but can occur at any age. Treatment. People with type 1 diabetes require lifelong insulin therapy to survive. Insulin is usually administered through injections or an insulin pump. Symptoms. Common symptoms include excessive thirst, frequent urination, unexplained weight loss, fatigue, and blurred vision. Type 2 diabetes. Cause. Type 2 diabetes is primarily linked to genetics and lifestyle factors, such as obesity, physical inactivity, and poor diet. In this type, the body doesn't use insulin properly, insulin resistance, and may not produce enough insulin to maintain normal blood sugar levels. Onset. It typically develops in adults, but due to rising obesity rates, it's increasingly being diagnosed in children and adolescents. Treatment. Treatment options include lifestyle modifications like diet and exercise, oral medications, and in some cases, insulin therapy. Symptoms. Symptoms are similar to type 1 diabetes and may also include slow-healing wounds, frequent infections, and tingling in the extremities. Gestational diabetes. Cause. Gestational diabetes occurs during pregnancy when the body cannot produce enough insulin to meet increased insulin needs. Onset. Typically develops during the second or third trimester and often resolves after childbirth. Treatment. Diet, exercise, and sometimes insulin therapy are used to manage blood sugar levels during pregnancy. Risks. Women with gestational diabetes have an increased risk of developing type 2 diabetes later in life, and their babies may be at risk for complications at birth. Other types of diabetes. There are rarer forms of diabetes, such as monogenic diabetes and secondary diabetes, which result from specific genetic mutations or other medical conditions. Common complications of diabetes. Uncontrolled diabetes can lead to numerous complications, including heart disease, stroke, kidney disease, neuropathy, nerve damage, retinopathy, eye damage, and poor wound healing. People with diabetes need to closely monitor and manage their blood sugar levels to reduce the risk of complications. Prevention and management. Type 1 diabetes cannot be prevented, but type 2 diabetes can often be prevented or delayed through lifestyle changes like maintaining a healthy diet, regular exercise, and weight management. Management of diabetes includes regular blood sugar monitoring, medication or insulin administration, dietary control, and maintaining a healthy lifestyle. Diabetes is a serious medical condition that requires ongoing attention, but with proper management and care, people with diabetes can lead healthy and fulfilling lives. Regular checkups with healthcare professionals are essential for monitoring and adjusting treatment plans as needed. Recognizing the early warning signs of diabetes mellitus is crucial for timely diagnosis and management. Here are 10 common warning signs and symptoms of diabetes in detail. Frequent urination, polyuria. Individuals with diabetes often experience frequent urination. This occurs because high blood sugar levels lead to the kidneys working overtime to filter excess sugar from the bloodstream. As a result, you may find yourself needing to urinate more frequently, especially at night. Excessive thirst, polydipsia. The increased urination caused by diabetes can lead to excessive thirst. To compensate for the fluid loss, you may constantly feel the need to drink water or other beverages. Unexplained weight loss. Rapid and unexplained weight loss is a common sign of diabetes, particularly in individuals with type 1 diabetes. When the body cannot use glucose for energy due to insulin deficiency, it starts breaking down muscle and fat for fuel, leading to weight loss. Increased hunger, polyphagia. Despite eating regularly, people with diabetes may experience persistent hunger. This is because the body's cells are not getting the necessary glucose for energy due to insulin-related issues. Fatigue and weakness. High blood sugar levels can lead to fatigue and a constant feeling of weakness. The cells are not receiving the glucose they need to function properly, which can result in reduced energy levels. Blurred vision. Elevated blood sugar levels can affect the shape of the eye's lens, causing blurred vision. This symptom is usually temporary and improves with better blood sugar control. Slow healing of wounds. Diabetes can impair the body's ability to heal. Minor cuts, bruises, or sores may take longer to heal or become infected more easily. Frequent infections. High blood sugar weakens the immune system, making individuals with diabetes more susceptible to infections, such as urinary tract infections, yeast infections, and skin infections. Tingling or numbness neuropathy. Diabetes can damage the nerves, leading to a sensation of tingling, numbness, or burning in the extremities, particularly in the hands and feet. This condition is called neuropathy. Increased irritability and mood changes. Fluctuations in blood sugar levels can affect mood and lead to irritability, anxiety, and mood swings. People with diabetes may experience emotional changes when their blood sugar levels are too high or too low. It's important to note that the severity and combination of these symptoms can vary among individuals with diabetes. If you or someone you know experiences several of these warning signs, it's essential to seek medical attention promptly for a proper evaluation and diagnosis. Early diagnosis and effective management of diabetes can help prevent complications and improve overall health and quality of life.